Glasgow Coma Scale, GCS, is a clinical scale used to reliably measure a person's level of consciousness. The scale assesses a person based on their ability to perform eye movements, speak, and move their body. Check eye response first. Is it spontaneous? Then, 4 points. Eye opens only to sound. 3 points. To pressure or pain. 2 points. Or no response. 1 point. If patient not responding, apply pressure to one of the patient's fingertips. Squeeze trapezius muscles. Or apply pressure to the patient's supraorbital notch. Verbal response. Orientated. 5 points. Confused conversation. 4 points. Inappropriate words. 3 points. Incomprehensible sounds or groans. 2 points. No response. 1 point. Motor response. Ask the patient to lift arm and make a fist. If the patient obeys command, 6 points. Localize to pain, 5 points. Withdraws to pain, 4 points. Decorticate or abnormal flexion, 3 points. Decerebrate or abnormal extension, 2 points. No response, 1 point. Assess pupils with a torch. P for pupils. Check pupils are in the center of iris. E stands for equal. Check both pupils are same size. R for round. Pupils should be perfectly round. Next R for reactive. When torch shines, pupils should get smaller. L for light. A stands for accommodation. Eye's ability to see things close up and far away. Pronata drift. Ask the patient to close the eyes, then to stretch out both arms facing the ceiling. The patient should maintain this position for 10 seconds. If the motor pathway is intact, the arms should remain in this position equally. Patients with a slight weakness in one arm won't be able to keep. Pronata drift indicates abnormal function of the corticospinal tract in the contralateral hemisphere. Muscle strength. Ask patient to squeeze hand against examiner hand tightly. Boxing scene. Ask patient to make a boxing scene. Ask patient to push when examiner pull and vice versa. Ask patient to make a chicken wing stand. Ask patient to push when examiner pull and vice versa. Ask patient to raise legs towards ceiling when examiner pull and ask to push to resistance and vice versa. Ask patient to bend knees. Ask him to pull when examiner push try to resist. Dorsiflexion is the movement that occurs at the ankle where the foot is lifted upwards. This is the opposite of plantar flexion, which occurs when pointing the foot downwards. Plantar flexion describes the extension of the ankle so that the foot points down and away from the leg.